Welcome to Dark Horse Matters, the show about people, their passions, and their pursuit toward manifesting their dreams in real life. I'm your host, Bev Matayoshi, and I'm passionate about finding these passionate people and sharing their stories with you in hopes to light a fire under you to go after your dreams. So if you haven't already, go ahead and like and subscribe, hit the bell so you can be notified every single time I have a new story on here. And for those of you returning, I really appreciate your support. It's been awesome. I'm so happy that we're going on season 3, and this is our RDH series. So I have a lot of really amazing guests lined up for you this year. So today I am super excited about this person I recently met this summer at a very amazing event in Orlando at the RDH Under One Roof convention. It was just really incredible to be under the same space with such passionate dental hygienists and medical professionals. So, okay, I am a very busy person. I'm a full-time dental hygienist clinician, and I'm a serial entrepreneur, and I am a single mom. So I'm always like, running around. And when I look at this woman, she just inspires me so much. I do not understand how she has enough time in one day to do everything that she is so amazing. So I'm going to introduce her to you right now. She has accomplished so much in her time. She's a dental hygienist, a very passionate one, but she's also a chiropractor, physician. And she is she's the founder of SWIIFT, which is like a group that really honors and features empowers women to go and get educated in the medical field. And that's a nonprofit organization. And on top of all of that, she's also an active member of the American Dental Hygiene Association and the American Chiropractic Association as well. So I don't even know how she handles all of this at once. And on top of that, she's a mom and a wife. So she is superwoman to me. I can't wait to introduce you to her. So please give a warm welcome to Dr. Karen Gordon. Woo! Hi. How are you doing?
Hi, how you doing? Good.
I'm so grateful for you to be on here today. I've been just interviewing and meeting dental hygienists from all over the world. And it's just been super inspiring to be in front and surrounding myself with such accomplished people. I'm just so grateful to have you on the show today. Thank you so much for being here.
Oh, thank you for having me. I'm so excited. I met you last summer and I've been following you, and you have so many interesting things happening. You speak to so many interesting people. I mean, you just keep amazing me with the content that you have. I'm just so honored to be one of your guests today.
Oh, thank you. So everybody out there, we met at a dental hygiene convention last year in Orlando. It just blew my mind how many hygienists there were doing so many things. Like a lot of hygienists just feel stuck, or we don't really know what else we could do. It just really amazes me how these women are innovative and they're pushing and really growing the profession into something more amazing that's going to keep expanding. So before we get into your journey, can I just ask you to give us a background about yourself? Like, where'd you grow up?
Sure. So I am Jamaican. I grew up in Jamaica. I spent most of my teenage years there, and I migrated here to the States. And I've been living here since I was 19. And when I came here, at first I was in love with dentistry, but I didn't know it yet. And when I had the opportunity to go to school, I'm like, what am I going to do? I'm like, dentistry is so long, become a dentist. I'm like, maybe I should just find what's closest, right? And then, I went to school and became a dental hygienist. And that's where the love for dentistry began. I've been practicing for the last 17 years. And recently I, had an epiphany, see people around me having lots of back pain, neck pain, and, family members. And I remember one of my family members went to the chiropractor, and it was the only person that could actually help her with her situation. And I was so intrigued by that. And I did dig deeper, and I'm like, I'm holistic. I can do more for people, and I can not just talk to them about their oral hygiene. Now I can start talking to them about their systemic health and what's going on with them from a neuromuscular perspective. I'm like, you know what, this might be for me. And lo and behold, that's what happened. And since then, I've done a few things. I started, once I graduated from school, I opened a practice with one of my colleagues. And from there, am actually now teaching full time. I do still practice dental hygiene like once a month. And I still try to be very active in the dental hygiene community and the dental hygiene space and the dental space because there's lots of educational opportunities for us out there, and I want to be a part of that. So that's my story, and I'm sticking to it.
All right. It just blows my mind because I just remember how intense dental hygiene school was. And how far into your dental hygiene career did you decide to go into chiropractic?
Well, really and truly, if I'm sure you know Carrie Carter Shirellis.
Yes.
Yeah, we work together, and we've been our journey started about the same time. She's been in dentist a little bit longer than I have, but we used to work together. And prior to me going full time into school, we met and we worked together briefly. And one of the things that we all both realized that we're getting burnt out. Dentistry can easily burn you out if you don't know what you're doing. I worked for corporate for 12 out of those 17 years, and it was mounting up. And every time I would see a patient, it's always have this burning desire to help even more. And when the opportunity came for me to make the transition so I could learn something new, I did it.
Wow. That is just amazing. Like, I just remember when I got out of school, how I was just like, I don't even think about going back to school. I just wanted to jump in, help people. And, but I can totally hear what you're saying about getting burnt out, because right out of school, I had all this crushing student loan debt. And I just remember working 6 days a week. I think I did it straight for 5 straight years. And that's insane, that schedule, and it's really hard on the body if you don't know what you're doing. And I think a lot of hygienists are feeling that now. But the great thing is there's a lot of education out there that teaches people how to work smart and get in. So I wanted to kind of ask you, like, what drove you initially? Where's your drive and your ambition come from to wanting to just learn and help people? Where does that energy come from?
Oh, I don't know. I've always been passionate about helping people. I don't feel like I hate seeing people in pain, and I really feel very empathetic towards the situation and what they're going through, and it drives me to want to help them even more. So, I don't want to say like from I was a kid, I know it sounds corny and cliche, but I don't know. I think since I was a kid, like I always knew I wanted to do something that helps people. And I didn't know what it was. I just, kept on pushing. So drive and determination, maybe it's a Caribbean thing, because Caribbean people are always like super driven. I don't know what's wrong with them, but we're always like hyper focused on a goal. And, no matter what kind of adversity we go through, we always trying to do better for whatever reason, whatever it is. Even if it's, some people might think of it as the most menial job, but we'll take the most menial job and do the best as we can out of the most menial thing. So I don't know what drives me. I think just the ability to want to do better and help people even more, and see when, things that people shouldn't tell me is you can't do it. Right? Mm-hmm. If you tell me that, then I'm gonna do it just because you told me I can't do it. So trying to really prove to myself that I can do better, and I can attain this thing. That's part of my drive.
What about your parents? Like, did they come to America at the same time as you, or are they still over there? Like, what's going on?
I grew up with my dad. My dad, he lived here for a while, and then he lives in Jamaica full time. Um, he's older. I'm an old grandpa dad. If I don't know if anyone knows what that means, it means like your dad's old. Okay, so he had me. He had me when he was much older, and when I was growing up, I grew up with him, and he's an old dude, so he has old ways and how he does things. My mom was here in the States. She has a different. I have many siblings. If you know Caribbean people, we have like a lot, right? Like I have 11 siblings. Like that's too much. Like
Wow.
I can't count them all. Like, what's your name again? It's too much. So like my mom has like one set, and like my dad has another set, and then in between the two, I have one sister that we share. But it's hard to keep track of all these people. Like, who are you again? So, you know, my situation, I won't say it was like I don't know, it wasn't rough or anything. My dad was strict about school. He didn't care about anything as long as he did well in school. And my mom, she's very more artsy and very hands-on. My dad is more businessman to the book. And I think the combination of the two of them kind of brought who you saw today, really.
Wow. That's crazy that you came from such a big family. I thought I came from a big family and I have 4 siblings. That's like nothing compared to I can't even imagine how many personalities that you have to deal with all of that.
And it's funny, they're all different ages. So I have siblings that are about the same age as my mom. And I have an older set, and I have a set that's just much younger than me. And my youngest brother, he's like 21. So, they're all spread out. We come from different generations, and we didn't all grow up together, but it's an interesting dynamic.
Yeah, I would love to come to a family reunion.
Be out of control.
That'll be a reality TV show right there.
Got that right.
So what part of your career did you become a mom? Like, how did you put into the mix of everything that you're doing?
So, like my son is like a smart ass, so he'll go back and track like when we got married and when he came along. I'm like, why are you even doing that, right? So I would say right out of as soon as I was done with hygiene school, we got married, and I'm like, oh my god, I think we're pregnant. And then there's my son. He's 16, and then my daughter I have much later. She is 10, and I had her. While I was in, seasoned hygienist, it was really hard actually. One thing I can tell anyone that's a hygienist that is looking to have a child, I'm gonna keep it real until it goes wrong. Definitely make sure you plan ahead. If you don't have insurance, it's like a big thing. Lots of people work private practice that don't have insurance, and they don't really know or even think that this is going to be an issue. But having insurance was a big thing for me. So just so happened I had a job at the time that gave me okay benefits, and it made it plausible. When baby number 2 came along, I was smarter. It's older. They consider me a grandma mom, whatever. But but I thought about what I need to do. I researched before number 2 came along, make sure the job that I had at the time had decent benefits, and I kind of planned ahead for that one. And it was rough because breastfeeding and trying to run back and forth with a baby, and you're doing dental hygiene, no bueno. Trying to be locked up in the room. Oh, it's pumping time. And
elbow deep in someone's like period on pockets.
I'm telling I'm like, let me just hold up, give me a minute. And it was so funny. I remember that when I had my daughter, shortly after, the dentist I was working with, she got pregnant with her baby, and she had to do kind of like the same thing: run to the back, pump, and then go back and do an extraction. Same thing. I have to be the pump, pump, pump. Okay, scaling rope planing real quick. All right, I gotta go to lunch. I have to go breastfeed. Like a crazy person. It was really challenging at that time. So definitely, as a dental hygienist, you want to make sure that you plan your time and your funds accordingly. Make sure whichever job that you have long term, short term, AFLAC. You make sure that you have funds put aside just in case you feel like you don't want to go back to work, and make sure that you have someone that can assist you. Like I had great help. My mother-in-law was there with me, and she was awesome. Both my kids, and she helped me out a lot. Like having family is a great help when you have kids.
I'm glad you brought that up because, when I was looking into getting into dental hygiene school, everyone kept telling me how flexible it was, and you can go on vacation, you can, do all these, you can plan your schedule around all your fun, basically. But, I never thought about being a parent, and I was in my 20s, and I always just thought, when the time came, everything would be all right because it's flexible, but I mean, I never even thought about what happens if I'm a single parent, and as a single parent, when I had kids, it just so happened that I was very lucky at the time that I had a job that had medical benefits. If I had had my kids not in the state of Hawaii at that job that I was at, my life would have been so much different. I think like a lot harder. And, I'm always so grateful that I was in that place when I had kids, because I did not plan my kids. They kind of just like, hello. And I was, they're the best things that ever happened to me. But at the same time, financially and the medical insurance, I was just so grateful. I felt like God was with me because I wasn't in a situation where, I was, I was struggling, but it wasn't like, I was in dire. I was very fortunate. I had a lot of support, definitely.
Right.
But those of you who want to become dental hygienists, like there's a lot of planning ahead. If you want a family, all that kind of stuff, like definitely planning ahead definitely helps.
Not to cut you, but that's why some people poo-poo on working for corporate, but that's one of the perks of working for corporate. I'm not going to say, oh my God, it's the best thing since sliced bread, because we all know how corporate is. Corporate, you're going to work for them, you have to produce for them. But at the same time, I had full benefit. Like for me, that was the most important. If something happened to me, then at least I would have some kind of protection from my family. And that's kind of where my head was at the time when I worked for them. I worked for them for 12 years. No, I'm sorry. I misspoke. For 9 going on 10 years. I worked for one company, and the other one for 3, almost 4 years. So for the most of the time that I was working, I worked corporate.
So when you decided to go back to school to do chiropractic, tell me about that. That's what I'm interested in. How did you
that was rough.
That
I mean, I don't even know what I did. I don't know how I did it because it was not easy. I have to say I'm a very loving and supportive husband. That's alone. I have that too. And when it came to going back to chiropractic school, some of the things I did when I got into the program was start by kind of stockpiling. I made sure that I paid off as much and as many of my bills as I could prior to going into the program, because I know I wouldn't have a source of income. So I tried to make sure that that was taken care of that way. And then when it came to like my vacation, stuff like that, I took it towards the end of the time that I was leaving. One tip though, guys, let me tell you the truth. I'm gonna keep it real. If you're planning to leave your job because you need to do something that's for you, then you have your vacation time, take your vacation time. Okay. It might not seem ethical at the moment, but if sometimes you tell an employer, and this is what happened to me, the employer actually switched my how would you call it, my status from full-time to part-time, so that when I would lose all of my benefits. And I lost my vacation. They wouldn't pay it out because they had switched it before the year was over. So I have learned to be cautious about who you give your information to and what information that you want to give them. So now I look at everything a little bit sus. Like, let me see what I'm doing. All right, I'm planning a little bit closer to the time, and then I'll let them know that we're going to have a separation of employment and so on. But one of the things I did do, I didn't burn my bridges. I still left my line of communication open. I made sure that I was able to at least still work. I kept my license active, because chiropractic school was 3 years, and was 30 months. Not quite 3 years. I'm sorry, it was 40 months long. So not quite 4 years, but I made sure I kept my license active. Whenever, as soon as I got a chance off of school, I would just work so I can bring in income. So those are the things that I would do to make sure I didn't go crazy financially. Healthcare wise, I use government benefits. That was the best way, because my husband doesn't carry insurance. I used to be the one that carried insurance. And that's what we did. And we were very frugal, and we're still very frugal.
Mm-hmm. That's really amazing, though, that, you did everything in a smart way, and that's so amazing that you accomplished all of that. Like, I think it's a very interesting dynamic between being a dental hygienist and a chiropractor. I think that's a very smart combination. I kind of want to marry a chiropractor.
Yeah, you won't have no neck pain, no back pain, right?
my spine would be so straight.
Right.
Oh.
It's funny you say that. We're similar, but actually more similar than people would think. We care about overall health, right? Even though as a dental hygienist we start with the mouth, it doesn't necessarily mean that that's where we stop, right?
Mm-hmm.
We still look at different things. I mean, I used to think of myself as Sherlock Holmes when I look at somebody's health history, right? I'm going through their health history. I'm trying to figure out, okay, so why do you have so much cavities? And I've been searching through, then I start asking them the questions. And then I'm like, all right, we need to come up with a plan. And even though, some people would think of themselves, okay, I'm just going to clean your teeth and see them in 6 months, right? I'm like, okay, I'm going to clean your teeth. We're going to solve this problem. I'm going to figure out why you're getting cavities, and we won't have this issue the next time, right? That's how I used to think. So as a chiropractor, okay, you have this problem, you keep having back pain. How am I going to, I can still bring the same frame of mind and focus when I work as a chiropractic physician. It's like the same type of thinking. How can I solve this problem? We're similar. We use our hands. We're highly skilled, and we care about our patients' overall being, and we always have to be re-educating and educating our patients. And those are the very close things that we do as practitioners. Even though one is in the mouth and one is on the spine or the extremities, it's almost the same process,
Right. I wanted to ask you, because I know you do a lot of education on the TMJ, and we as hygienists know what a widespread problem, clenching and grinding and bruxism, what that is. And a lot of my patients don't know what that is, what the source is, what it's connected to. And I think it's very interesting that you're a chiropractor where you kind of specialize on the outside, you can kind of see, and, and also with TMJ and just with us as hygienists, we see people, very often, more often than people see their physicians. So it's kind of interesting to see, like, you being in that position where you can help people kind of make those connections. So the TMJ, can you explain a little bit about how you educate and how you tie the two
disciplines together?
Yeah.
Sure. So, the TMJ, as just to be clear, the temporomandibular joint, we all have one. It's really right here, almost the corner of our jaw. It helps us with opening and closing the mouth, and it's a major part of chewing, talking, and even how it stays at rest with breathing. So it helps us to do everything that we need to do, right? Communicate, eat, sleep. So the connection that we make is sometimes patients that have TMJ pain or temporomandibular joint dysfunction, they also have headaches. They have not just jaw pain, they have neck pain. Sometimes they have upper back pain. And what we've realized also from a dental hygiene perspective, I realized that they're clenching. And when they're clenching, they're putting a lot of stress on their sternocleidomastoid, their trapezius muscles, their occipital muscles, and that's what is part of the reason. We also see that if there are bites off, that's an issue. And we also I talk to my patients about their habits. If you're able to talk about their habits, what are they doing on a regular basis, then you can make some lifestyle changes and modifications to kind of help them through that process. So how do I make the link, right? You come to me with jaw pain, right? I'm not just going to look on the outside. I actually ask you to open your mouth so I can see how much you can open, what's your range of motion. Then I look onto your biting surface, the occlusion, and your occlusal surfaces to see if you really have any wearing there. Then I look to see if you're deviating left or right, how much is the deviation, is there any crack tufts? That's what we would evaluate for, right? Usually as a dental hygienist, you try to see if there's clicking or popping of the joint. And then from a neuromuscular standpoint as a chiropractor, then I'm checking to see where those tender points, those trigger points are, how are they functioning with their cervical rotation? So that means, how they're doing with their neck, all the range of motion in the neck, flexion, extension, all of that. And I look at all those things combined, and then I take it a little bit step further because some people don't even realize that the behavior in the joint is mimicked in the pelvis. So you can have low back pain and pelvic pain, and it's all linked to the fact that you have an issue with your temporomandibular joint also. The fascia, the fascia is continuous. It doesn't separate. The muscles are actually continuous when you're talking about the muscles of the back and ones that support the pelvis and support everything is continuous. It's like a domino effect. So when you start looking at these similarities and you start seeing where there's some dysfunction, then I kind of go into the next step. And the next step, there's always what we call a biopsychosocial component of pain. Your physical manifestation of pain is affected by your mental state. What exactly is causing you to grind? What stresses aren't you managing correctly? So the dental part of me wants to know that, and the chiropractic part of me wants to know that. What can I do for that? Now, as a chiropractor, I can treat that neuromuscular dysfunction. I can give you an adjustment. I can do soft tissue mobilization. And then we'll look at some things like ergonomics, look at the food that you eat, some of the habits that you have. As a dental hygienist, we'll be looking at what you eat, how you eat. Are you clenching or grinding? Do you have a night guard? When's the last time you seen your dentist? Stuff like that. So I find the little links and the little things and kind of marry them. And then that's how I would treat my patient.
Right. Do you even evaluate sleep apnea too in your?
I can, but I haven't gone that far yet. I'm still in the learning stages of sleep apnea, but there is a very huge connection. The papers and the research out there does support that. I can, but I haven't gone into that realm just quite yet. I'm sure once I have been fully trained on it, then I'll be, including that as part of my evaluation.
Yes. I interviewed a doctor on the show by the name Dr. Downs. Amazing, amazing man. He believes that healthcare can be changed in the future by linking dental and the medical together through the vessel of a chiropractor. Like that relationship a dental office could have with a chiropractor could really, really be the gatekeeper on getting people diagnosed with apnea, sleep apnea, because it's such a widespread, undiagnosed problem. Most people don't even know they're not breathing at night, you know? And
right.
We're one of the people that see, but we have no relationship with the medical doctors. We can tell
right.
them to get a sleep study, but are they going to do it?
Exactly.
Yeah. So it's kind of nice to know that in the future there is, if dentists can build more relationships with the chiropractors, that could be another referral source to get people.
Of course. Definitely. I agree with I agree with him, because we are portal of entry providers. And for those who are not aware, portal of entry means you get the first contact for someone to come to see you so that they can seek treatment. Whether you need to refer them out or need to be treated, we can do that. We are in fact physicians. So when we would be like that nice link, just like how, because I'm becoming more involved in the myofunctional community, and not just chiropractic, but I'm looking at things like making those little connections, like how can I marry the two and bridge that gap? And myofunctional therapy is one of the ways I could do that and teach people about, their rest position, sleep apnea, and how it affects the musculature of the tissue and their ability to breathe, speak, eat, chew. It's literally all connected. And if we take it even further and we start looking at it from a neurological perspective, if you don't have things firing the right way, then it's going to affect how the muscles behave and how everything else behaves. So, I'm slowly making my little links and trying to educate everyone as I'm learning about the ways that we can connect all these different dots, because we're not all that different. We might work specifically on an area, but we really need to be working together as teams with our patients, because that's the only way we're going to move forward as clinicians, is to work as a team for the common good of the patient.
Yes, I agree. Man, you're so intelligent. I think you're such an intelligent person, and I love how you're trying to make sense of and making those connections, because I feel like today's medicine is so disconnected. And I love that you're passionate about making those connections for people, because I really, really, really believe it's going to make a huge difference. Those of you out there listening, like, I just want to point out that she's also an educator and a public speaker. So she really, really is not just about doing her work and, being the doctor. She really wants to get that information out there to really help people. So can you kind of go into that a little bit? Like, what is that journey like, getting into the speaking world and being an educator in dental hygiene and chiropractic?
So in chiropractic, because I have that dental background, it's kind of interesting, new, and exciting. So it's easier to, I think, like I'm going to be speaking for the Faculty of American Chiropractic Association, and just doing that, the linking the temporomandibular joint to the pelvis and how we can, be more useful that way to our patient. It's been easier that way. When dentistry is a little harder, it's a little harder to get my voice out there, but I'm slowly doing it. Speaking, I find topics that I really do love and I think are interesting. For example, ergonomics. People think it's only just about how you sit up straight, right? You notice I'm sitting in a very relaxed position. I don't necessarily conform to the sitting up straight all the time. Sometimes you need to be relaxed. But it's not just about how you sit. It's not just about the things around you. It's more than that. It's about the food that you eat. It's about your relationship with your workspace, and it's the way in which you make those connections so that you can work. One of the topics I found interesting was ergonomics, like kind of putting nutrition and ergonomics together and how you use it to help your body do better. As a neuromuscular physician, I'm not just looking at the muscles, I'm looking at how are you feeding those muscles? Like, are you nutrient deficient? Is that the reason why you have pain all the time? What else can we do to make your life easier as a practitioner? Many hygienists, we don't go to the bathroom.
A whole day. I haven't peed.
Yeah. Then we end up with a bladder problem or a cramp in the leg, a cramp in the hand, and we don't understand why this keeps reoccurring. Keep having kidney infections, don't know why. I was working as temping the other day, and I noticed that the hygienist, she saw 15 patients. I counted it, 15 patients, no break, right?
I would die.
She started at 7 and she ended at 5:30. Now, I don't care if people want to make extra money and commission or whatever. I personally know a hygienist that dropped dead at home because she was working like that. And no one, she didn't show up to work, and that's how they found out she was dead. So is it really worth it for you to be physically stressing yourself in that manner, not really taking into consideration that if you're going to take from your body, you're going to demand from your body, you need to put fuel back in. And that fuel is not just food, it's things that we do to our body, how we hydrate ourselves, how we feed ourselves, how we work in a space that allows us to move. All those things are what encompasses ergonomics. So, I'm trying to educate other people about that aspect of ergonomics, as opposed to only looking at ergonomics from just a how am I sitting standpoint.
Right. I remember, no, it's so important. And I think a lot of dentists don't realize, because they don't spend the time in our rooms, how the way the computer is set up in relationship to where your chair is, how your chair is, that functionality is so important to your body. I temped at this one office. I mean, the sweetest doctor ever, but just the way it was set up was so non-functional. And literally, when I had a patient that canceled, he walked into the room and my butt was in the air because I was like rewiring stuff and just trying to make it easier, not only for me, but the hygienist that comes the next day. I was like, she's gonna thank me.
but you're so right. Why are you cramming people into these very small spaces? We should have the ability to either walk around our patients with their chair. Sometimes I wonder who designs these offices.
Right.
We don't even really think about space planning. We need to actually have a working distance, just like when you buy loops. You can't just buy a pair of loops random without being measured for those loops, right? You need to actually know how far and what the depth of inclination is when you're looking into the mouth, so that when you're working, it's the correct working distance. Same thing. Do chefs just work in a cooped up space? No, they actually know the working triangle of the kitchen, from the countertop to the stove to the fridge to whichever surfaces that they're prepping and preparing food for being a chef. So similarly, in that profession, with our profession, we need to be able to know what our working space is. We can't think one cookie cutter fits all. Right. I remember working the first office I worked at in corporate. It was so restrictive. Like I had no choice but to stay in a cramped position for a long time because there's no room for me to move around the patient's head. I like moving around my patient. I don't like being stuck in one position. And then to talk about how we, even doctors don't think about ergonomics. Who in their right mind works 8 hours a day nonstop? Who does that? You have to take breaks. Like, how are you supposed to function? You should have a break in between patients. Like, that should be a part of patient care. So one of the things I had to start doing is learn to speed up my time. So I'm done at the 45-minute mark. So I have that 15 minutes so I can breathe. Why should we have to do that?
Yeah.
Right? So not only am I stressing my body to work harder and faster so I can just get a moment to go pee or to get a sip of water, or if
Right.
take a quick snack, I can't because they don't give me a break until 4 hours into the work shift. And then they still want to talk to you on the 1 hour brunch break. but my point is when we do when we're working, it's just not natural for us to be scaling. If you think about what we're doing the same repetitive movement approximately 30 to 45 minutes nonstop. That's
Mm-hmm.
not normal. You stare. I used to have eye problems because I'm staring at the same spot in the mouth for 45 minutes without blinking. Who does that?
Yeah. I mean, that's kind of normal now with everyone in their jobs in front of their computer, in that same over position.
Yeah, like why are we doing this to ourselves? Stuck. We need to move around. We can't, it's just not normal to stay still for that long time and do such deep concentrated work. So, one of the things that we need to advocate for ourselves is to make sure that we have, establish those things like early out. Look, you give me an hour, I'm done. I'll be done in 45, but please don't ask me what am I doing. I still need to clean my room. I still need to set up. I still need to write my notes. I still need to have a sip of water. I need to walk away from this place. I need to change position before I bring the next patient in. So, as time goes by, as a practitioner, I learned a way to figure out how to kind of best utilize my time. But I feel like, why should we have to do that? I mean, you should, but why shouldn't, there should be a break in between seeing patients. It's kind of weird, I think, that whole assembly line.
Mm-hmm. I mean, I guess it's just so normal. I mean, that's the way it is. It's the way it's always been, and no one really questions it until now, when they're just seeing that burnout. That word burnout is just so apparent and evident now. That people are starting to become more aware, and I just think it's really great now that we are talking about it and bringing more awareness about it. I love all those just different things that we can learn about ergonomics. It's so important. I am not the best. I do not have very good body mechanics. It's definitely something I have to constantly work on and pay more attention to. So I think it's really great what you're doing. Before I end the interview, I do want to ask you, what are your goals for 2023? Anything exciting? Not that you can add any more onto your plate, but I know you. I know how you are. I know you have something cooking, probably. So, what you got going on this year?
This year, I have, in March, March or April, I'll be speaking for Faculty American Chiropractic Association as one of the speakers. I'll have another speaking engagement coming up too in October. Right now, one is for IAOM, which is the International Association of Orofacial Myofunctional Therapists. I'll be speaking there. I think it's in Las Vegas. I don't remember where actually. I don't have to step over to time. And then the other one I'll be speaking for the Dental Hygiene Alliance via internet. And that will be in Canada. I'll be doing that online CE, which is great. But I plan to do I want to do more online events. I feel like I can connect with so much more people that way. I feel like one thing COVID has taught us is that we can't physically be there. Then we can utilize the internet, right?
Yes.
We can be anywhere we want to be in a matter of seconds as long as you have an internet connection. And I feel like I can still get the opportunity to speak to more people that way. And now that I'm not practicing full time, I really want to focus on more education, like educating the public, educating my colleagues, on going on vacations.
Yeah.
I think that's my plan for this year. I don't have any super big plans, but it depends on. I am going to be doing more table education for BioGaia actually this year. So we'll see. I'm not sure which events I'll be at yet. But that will be in the mix somewhere. Who knows what else will pop up? Maybe something else. Who knows?
That's great. Are you going to be at RDH Under One Roof in July in Nashville this year?
In July, I'm not sure yet. I have a lot of things going on from teaching wise. So teaching wise, I'm kind of I don't want to use the word stuck, but we've have a lot of changes that are going through, and I kind of need to support my students that way. But if the opportunity comes by and I have the availability, then yeah, that was really awesome. That was really a great event. It was meeting the whole RDH Mag team and the RDH Under One Roof team was awesome. I learned a lot. Can I tell you a lot? I met you. I met so many people. Everybody that you see on Instagram and doing the hot reels, I met all of them. They're so cool. And I thought it'd be good to see them again and hear what they've done. I really think that doing RDH Under One Roof, just that event opened my eyes up to the possibilities. Once upon a time, hygienists only thought they had to be stuck into a room. And now we're out here speaking on podcasts, we're making courses, we are KOLs, KOIs, doing different things, taking this profession to another level.
Yes.
So
absolutely.
I find that to be super exciting, and I won't necessarily say no to something. I just have to see where it can take me and who it can help.
Yes. We were in, there's so many different names, but RDH Under One Roof is the dental hygiene convention for the East region of the country. And RDH Evolution is this more intimate group where dental hygienists can learn how to go to the next level and progress the profession. Wonderful group of people, just smart. There's so many smart people in that room last July when I met you. Super exciting. I just want to thank you so much for coming on here, sharing. You're an amazing person. I really, really hope that you come in July because I want to party with you in person again.
Yes. You are super fun. So I definitely know we'll be laughing and having fun if I'm there.
Yes. Well, you have a great day. I just want to thank you so much for coming on here and sharing your story. And I know there's going to be a lot of people who are inspired by you and who are going to learn from you every time you do your speaking engagements. And I can't wait to see you in action. Maybe you will be speaking at RDH Under One Roof and I can learn from you.
Speaking into existence.
All right. Well, thank you everyone for joining us on Dark Horse Matters, the show about people and passionate people and going after your dreams. Like and subscribe, share with your friends so that we can just spread the joy and spread the passion around. Because if you are living your life without burning desire and a fire, then you're missing out. You're missing out big time. So thanks again. We'll see you next week. Be passionate.